So today there are 20 new community cases to report. All of these are in the Auckland region. This takes our total number of cases in the outbreak to 922, and of these, 352 are now deemed to have recovered. Additionally, we have 3 new cases in recent returnees in managed isolation. A quick update on Middlemore Hospital, where, as you know, there have been several cases recently identified. What I can confirm is, pleasingly to date, no staff or patients have returned a positive test following those 3 people presenting to hospital in recent days with COVID-19 or who've been found to have COVID-19. Most of these people will remain in isolation and be retested at the appropriate time, but to date, all have returned negative tests. The total number of as yet unlinked cases in the outbreak is at 34, although I note that 8 of these are from today's new cases. The 3 largest clusters in the outbreak remain the Mangere Church event with a total of 379 cases, secondary community transmission from that initial Mangere Church event, and that's got 164 cases, and then we have the Birkdale Social Network, which has a total of 76 cases. These 3 subclusters are part of a group of 16 subclusters or settings of interests, which we're using to aid our tracking of the outbreak. Of these 16, 7 are considered to be contained. And a further 6 subclusters, there is only household members or close contacts who are also in isolation who are becoming cases. So 13 of the 16 are either contained or the transmission is within known close contacts. And a number of those, the last cases were several days ago. So in just 3 subclusters, there is concern about possible spread beyond households, and of course, these are the focus for intensive follow-up. Across the system, we have around 350 very close contacts who are still in their 14-day isolation period, although most of them have already returned a negative test. Our experience to date shows that about 16% of this group will return a positive test at the day 12 test. And so this indicates both the importance of keeping people in isolation for the full 14-day period, but it also shows we could expect around another 50 cases just from our very close contacts across the outbreak who remain in isolation and are still to return that day 12 test. Now, of yesterday's 23 cases, we know that nearly half, that is 11, are contacts of other cases, and this includes a third, which is 7, who are household members of a case. 10 were infectious in the community with over 40 exposure events. Most of these relate to a small number of those people. We also want to know, of yesterday's cases, how many are unlinked cases. So at the moment, 10 are currently unlinked, or were unlinked. However, through the course of the day, we were able to establish links for a further 7. So at this point in time, there are just 3 for whom there's not a clear epidemiological link. Regarding the person who presented last weekend to Middlemore and was treated on a surgical ward, this person has 9 other household members who have tested positive. This has been clearly linked to the wider outbreak now, and we know where the point of transmission occurred. There are new locations of interest that continue to be identified. As I said, there were a number of exposure events from yesterday. Where those exposure events may have involved wider members of the public, they will be published as locations of interest, so please do keep following that locations of interest webpage on the Ministry's website. Today in hospital we have 18 people, all in the Auckland region, and with 4 of these people in intensive care. One of our new cases identified in the last 24 hours presented late and unwell to Middlemore Hospital and is currently in intensive care. I just want to emphasise the importance, therefore, of anyone who needs care for any reason to seek that care immediately, either through calling Healthline. If it's an emergency, call 111. But what I can reassure people is that our hospitals are safe. They have very strict protocols in place to ensure that anyone arriving, or patients and their family, as well as staff are kept safe. So please do not delay or hesitate seeking care.
I want to acknowledge how hard it is when numbers jump around as they have been doing in the last few days. And that is not a sign of failure. It's not a sign that what we are doing isn't working. It just means that Delta is harder, and the tail, therefore, is harder. But it's not impossible. Every day before Dr. Bloomfield and I come down to the theatre, we have a call with the team who are working on this outbreak on the ground. Today you heard a lot of detail from Dr. Bloomfield on the clusters that they are managing and where we're still seeing a bit of onward transmission, particularly within households, where they're looking good and where we have some more work to do. But something that one of the team on the ground said stood out to me as something I should share with all of you, especially those of you in Auckland. They said that we have to remember we still know where the vast majority of our cases are coming from. This is a simple and important reminder because it's an indication of the general control that we have with this outbreak. With Delta, there is an element of some steps forward and some steps back, and I know how especially hard this is on Auckland, who are experiencing the anxiety of the case numbers every day and the reporting of some of those details. And I'll remind people that what often might be reported as a missing or unconnected case very often will be linked back to our outbreak, often with the help of science and genome sequencing that can take just a little bit longer. But we feel all of that anxiety with you as well. But our general direction is positive, and our goals remain the same. Beat the virus, get out of these heavy restrictions, vaccinate. On that note, I have an update. You'll recall that this week we announced that we have finalised a deal for more than 250,000 Pfizer vaccines from Spain. These are now in the country. Today I can announce that we have also finalised a deal with Denmark for the purchase of 500,000 doses of the Pfizer vaccine. This will bolster our rollout throughout the remainder of September, where we had some constraint on the amount of supply we had, before the big batches we already had on order arrive in October. The delivery will be split evenly in two, with the first leaving Denmark early this week and arriving into Auckland from the middle of the week. I'd like to express our appreciation to Prime Minister Mette Frederiksen for making the doses available for purchase. Thank you to the Danish and European Union officials and to the team at Pfizer for their work helping finalise the deal. And thank you to the incredible work of our teams at the Ministry of Foreign Affairs and Trade, the Ministry of Health, MedSafe, Crown Law, Treasury, and to many others who have been working behind the scenes to negotiate this agreement. It has been a real team effort. Combined, the Denmark and Spain deals leave us in the strongest position possible to vaccinate New Zealanders at pace, protect our population, and begin to move beyond life with tough COVID restrictions. There is a vaccine there for everyone who wants one, for free, and it's available now. So please, get booked, get vaccinated, and be safe. It could literally save your life. You can see the difference vaccines are making in this current outbreak, but we're seeing it at an even much larger scale in places like the United States, where hospitalisations are so heavily dominated by those who are unvaccinated. But if your own health and well-being isn't enough to convince you, then do it for those around you. We know the vaccine helps break chains of transmission. It can make it less likely that you'll become infected and that you'll infect someone else. And indeed, that's what we're hearing from the tens of thousands of Kiwis getting vaccinated every day. People are being vaccinated for those around them, those they love, and the wider benefits it brings. And what a difference that is making. On busy days, we've been breaking daily OECD records for doses administered. And over this weekend, new drive-through and walk-in vaccination sites in Tamaki Makaurau saw the city reach an impressive milestone. 500,000 Aucklanders are now fully vaccinated. In the next couple of days, we are likely to reach 1 million first doses in the region. Thank you, Auckland, and keep it up. You are doing the very best thing you can do right now to avoid future scenarios like the one we're in. And so, if you're watching this and have not yet been vaccinated, here are a few options for you. There is capacity for 10,000 vaccinations a day at drive-through sites. These are the Park and Ride at Auckland Airport and the Trust Arena in Henderson. Please make use of these. If you're not yet booked for a vaccine, go this afternoon. There are well over 100 GP clinics in Auckland alone offering vaccination appointments. Check in at your local doctor's clinics for availability. Pharmacies are also available for vaccinations. If you jump onto bookmyvaccine.nz, you'll see that we have a new function which tells you the closest sites with available appointments, so you can assess where to go in order to receive your vaccination the fastest. Please book your slot today, or, as I say, drop into one of the drive-through appointments or drop-in centres and get it done as soon as this afternoon, no matter where you are in the country.